the permanent mandibular first molar. First, I will present the general features for the permanent mandibular molars before moving to the detailed description and characteristics of the mandibular first molar. The permanent mandibular molars are the largest and strongest teeth in the mandibular arch. This is due to the bulk of their crowns and roots, and also to the presence of two roots, widely separated, mesial and distal, widely separated, and the broad buccolingually, which provide extra anchorage for this tooth in the alveolar bone. Their crowns are quadrilateral, being wider mesiodistally than buccolingually, which is the opposite situation for the maxillary molars. Also, just like all of the posterior teeth, they are shorter cervico-occlusally compared with the teeth anterior to them. However, their dimensions are greater in all other aspects, especially the mesiodistal dimension and the buccolingual dimension. All mandibular molars have two roots, one mesial and one distal. The roots are widely separated, especially the first and second, and the rooted trunk is short compared to the maxillary molars. What are the characteristic features for the mandibular first molar? The mandibular first molar is the largest tooth in the lower arch. The mesiodistal dimension of the crown is greater by 1 millimeter than its buccolingual dimension. And the mandibular first molar is considered the widest tooth mesiodistally compared to all other teeth in the dental arches. It has 5 well-developed cusps. This is the mesiobuccal, this is the distobuccal, this is the mesiolingual, the distolingual, and the small distal cusps. All these 5 cusps are functioning. So the mandibular first molar is developed from 5 lobes, just like the maxillary first molar. However, its 5 cusps are all functioning, while the maxillary first molar, only 4 of the 5 cusps were considered functional. The mandibular first molar has 2 well-developed roots, the mesial and the distal. These roots are characterized by being broad buccolingually. They are widely separated at their apices and characterized by having a short root trunk. This broad buccolingual dimension and the separation of the roots provide the necessary anchorage for this tooth in the alveolar bone. Regarding the chronology of the mandibular first molar, the first evidence of calcification is at birth, just like the maxillary first. The enamel is completed 2.5 to 3 years, eruption at 6 to 7 years, and root completed 9 to 10 years of age. So, just like the maxillary first molar, the mandibular first molar erupts at the age of 6. So it's considered the first permanent tooth to erupt. Both the maxillary and mandibular first molar erupt when all of the other primary teeth are still functioning and still there in their position in the dental arch. So both of them are called the 6-year molars. The mandibular first molar, just like the maxillary first molar, is considered the cornerstone of the dental arch due to its position in the center of the fully developed adult jaw and due to its important role in establishing the normal dental occlusion. The detailed description of the buccal aspect. First, the geometric outline of the crown is roughly trapezoidal, with the shortest of the 2 parallel sides toward the cervix and the longest toward the occlusal plane. The mesial outline is convex in the occlusal third, then become concave above the cervical line, while the distal outline is more convex in the occlusal portion and then becomes straight from the distal contact area toward the cervical line. The mesial contact area is located at the junction between the occlusal and the middle third. So this is the position of the mesial contact area. This is the occlusal third, the middle, and the cervical. The distal contact area is near the center of the crown cervico-occlusally. This is the mesial contact area and this is the distal contact area. From this aspect, 5 cusps can be seen. All 5 cusps of the mandibular first molar are in view. These are the mesiobuccal, the distobuccal, the distal, the mesiolingual, and the distolingual. The mesiobuccal and the distobuccal cusps are relatively flat. The flattened buccal cusps is a typical feature for all mandibular molars. The mesiobuccal cusp is considered the largest cusp in this tooth, while the mesiolingual cusp, which can be seen in the background, is the longest, or with the highest length. These two cusps, the mesiobuccal and the distobuccal, make the major portion of the mesiodistal diameter of this tooth, about 80%, while the remaining 20% is occupied by the smallest cusp, which is the distal cusp. The distal cusp is convex and overhangs the root trunk. So these two buccal cusps are flat and the distal cusp is convex or rounded. These 3 cusps are separated by 2 developmental grooves. The mesiobuccal groove, which serves as a line of demarcation between the mesiobuccal cusp and the distobuccal cusp, and the distobuccal groove, which acts as a line of demarcation between the distobuccal cusp and the distal cusp. The mesiobuccal groove is the shortest of the 2 and usually ends in the buccal pit. So at the end of the mesiobuccal groove there is the buccal pit. Moving to the root outlines, the root trunk is short. It bifurcates about 3 millimeters below the cervical line into mesial and distal roots. The mesial root has a more convex concave outline from the cervical line to the tapered apex, while the distal root usually slants or extends in a distal direction and ends in a more pointed apex. Moving to the lingual aspect, the geometric outline is also trapezoidal, with the shortest toward the cervical line and the longest toward the occlusal surface. Due to the lingual convergence, which is found in the mandibular molars, part of the mesial and distal surfaces can be seen. 3 cusps can be clearly seen from this aspect: the mesiolingual, which is the longest cusp in this tooth, then the distolingual, and the lingual portion of the distal cusp. This is the lingual portion of the distal cusp. The 2 lingual cusps, compared with the buccal cusp, are pointed and have higher ridges compared with the buccal cusps. The mesiolingual cusp is the widest mesiodistally, followed by the distolingual cusp. These 2 cusps meet at an obtuse angle at their cusp tips. These 2 lingual cusps are separated by the lingual groove. These 2 cusps are separated by the lingual groove, which extend only for a short distance on the lingual surface of the crown. The roots are longer from the lingual aspect by 1 millimeter because the cervical line is located at a higher level lingually, at a more occlusal level lingually than buccally, which makes the root, both the mesial and distal roots, longer by 1 millimeter and the root trunk will be longer, so the bifurcation will start 4 millimeters below the cervical line. The mesial aspect. The geometric outline of the mesial aspect is roughly rhomboidal, just like all other mandibular posterior teeth. The crown has a lingual tilt along its long axis. This arrangement, as was mentioned before, is to provide a proper occlusion with the opposing maxillary molars. The buccal outline of the crown, this is the buccal and this is the lingual. How to differentiate between buccal and lingual? As was mentioned before, the buccal cusps are flat, while the lingual cusps are pointed. So this is the buccal and this is the lingual. The buccal outline is convex above the cervical line, outlining the buccal ridge. This is the buccal ridge. So the crest of contour of the buccal aspect is located just at the junction between the cervical and the middle thirds of the crown. The lingual crest of contour is in the center of the middle third of the crown, and the lingual outline of the crown is more convex compared with the buccal outline. From this aspect, only two cusps, can be seen and one root. The two cusps are the mesiobuccal, which is the flat cusp, and the long and sharp and pointed mesiolingual. So the mesiobuccal cusp is blunt or flat, while the mesiolingual is longer and sharper. The mesial marginal ridge, this is the mesial marginal ridge, is strong and located 1 millimeter below the cusp tips of the mesiobuccal and mesiolingual. Also, the mesial contact area is centered buccolingually and is located at the junction between the occlusal and the middle third at this position. Only one root can be seen from the mesial aspect. This is the mesial root. The mesial root is broad buccolingually and characterized by having a broad longitudinal depression or concavity extending along its length from the cervical line toward the tapered apex. This concavity extends along the middle third of the crown. This is a broad longitudinal concavity. So regarding the anatomical landmarks that can be seen from the mesial aspect, first there is the cervical ridge in the cervical third of the buccal aspect. There is the flat mesiobuccal cusp, the sharper and longer mesiolingual cusp, the strong mesial marginal ridge, this is the marginal ridge, the mesial contact area, this is the developmental depression, the broad depression, and only the broad mesial root can be seen from the mesial aspect. Moving to the distal aspect, more of the tooth can be seen from the distal aspect. So some part of each of the 5 cusps can be seen, and even the mesial marginal ridge can be seen. This because the tooth is shorter, the crown or the tooth is shorter on the distal aspect than the mesial, and the lingual and the buccal surfaces converge toward the distal. So as was mentioned before, the area where the cusps are flat is the buccal, while the long and sharp cusps are the lingual. So this is the buccal and this is the lingual. So due to the shorter crown length distally and the convergence of both the lingual and buccal aspects toward the distal side, more of the occlusal surface can be seen and all the cusps can be seen. In the foreground, we can see 3 cusps. First, the distal cusp, which is the smallest, the distobuccal cusp, this is the distobuccal, and the distal lingual, which is the largest of the three. So the distal lingual cusp, which is the largest, can be seen, then the distobuccal cusp, and the smallest distal cusp. We can see the end of the distobuccal developmental group. This is the distobuccal developmental group, which separates between the distobuccal cusp and the distal cusp. It ends in a small concavity just above the cervical line on the distal surface. The distal contact area is placed just below the distal cusp, and it's located in the middle third of the crown. This is the distal cusp. So this is the distal lingual, and this is the distobuccal. As mentioned before, all the 5 cusps can be seen. So this is the mesiobuccal, and this is the mesial marginal ridge. Even the mesial marginal ridge is visible. And this is the mesiolingual. So part of the 5 cusps can be seen. The distal marginal ridge is short. This is the distal marginal ridge due to the presence of the distal cusps. The distal root is slightly narrower than the mesial root in buccolingual dimension. Therefore, the lingual border, this is the mesial root, the lingual border of the mesial root can be seen from this aspect. The root is smooth, or sometimes there is a shallow developmental depression, shallower than that found on the mesial aspect. So to review all the anatomical landmarks that can be seen from the distal aspect, a lot of anatomical landmarks can be seen, in fact. First, the distal lingual cusp, the largest, the distal cusp, the distobuccal cusp, the mesiobuccal cusp, the mesial marginal ridge, and the long mesiolingual cusp. This is the short distal marginal ridge, the distal contact area. Both roots can be seen. In the foreground is the distal root, and the lingual border of the mesial root can be also seen. The occlusal aspect. The geometric outline is hexagonal. It consists of 6 sides. As it's obvious here, the crown converge lingually. There is lingual convergence, and the buccal and the lingual surfaces converge toward the distal. So there is lingual convergence and convergence toward the distal. The mesiodistal diameter or dimension of this tooth is 1 millimeter greater than its buccolingual dimension. The opposite arrangement is true for the maxillary molars. In addition, the buccolingual dimension on the mesial side is greater than the buccolingual dimension on the distal side. Another feature is that more of the buccal surface can be seen compared with the lingual surface due to the lingual tilt of the crown along its root axis or long axis. So this is the occlusal table, and you can see more of the facial than the lingual. Regarding the size of the cusps, there are 5 cusps. The largest is the mesiobuccal. This is the mesial, and this is the distal. So the largest is the mesiobuccal, followed by the 2 lingual cusps. These 2 lingual cusps are second in size. Then the distobuccal, and finally the distal cusp, which is the smallest. So the distal cusp is the smallest of the 4 cusps, and the mesiobuccal is the largest. The details of the occlusal table. There is 1 major fossa and 2 minor fossa. The major fossa is the central fossa, which is located in the center of the occlusal surface. It is roughly circular. This will be the position or the shape of the central fossa. In the center of this fossa, there is the central pit with many grooves radiating from it. The mesial triangular fossa is located just distal to the mesial marginal ridge, while the distal triangular fossa is located just mesial to the distal ridge. The distal triangular fossa is less distinct than the mesial triangular fossa. Since there are three fossa, there are three pits: the central pit, the mesial pit, and the distal pit. So there are three pits on the occlusal table of the mandibular first molar. Each cusp has its own cusp ridges and triangular ridge. So these are the cusp ridges of the mesobuccal cusp, the cusp ridge of the distobuccal cusp, the cusp ridge of the distal cusp ridge of the distal lingual, and cusp ridge of the mesiolingual. In addition, 5 triangular ridges: triangular ridge of the mesobuccal, distobuccal, distal, distal lingual, and mesiolingual. This arrangement gives 2 transverse ridges. There is no oblique ridge, but 2 transverse ridges. The triangular ridge of the mesobuccal with the triangular ridge of the mesiolingual form a transverse ridge. Another transverse ridge formed by the union of the triangular ridge of the distobuccal with the triangular ridge of the distal lingual. So there are 2 transverse ridges, 5 triangular ridges, and no oblique ridge. There are 4 developmental grooves. The main groove is the central groove. The central groove has somewhat irregular or zigzag course originating from the central pit and running both mesially in a mesial direction and distally to end in the mesial triangular fossa and distal triangular fossa. Just mesial to the central pit, the mesobuccal developmental groove joins the central groove and runs buccally between the mesobuccal and the distobuccal cusps to end in the buccal surface. Distal to the central pit, this is the central pit, the distobuccal groove joins the central groove and runs in a distobuccal direction, passing between the 2 distobuccal and distal cusps. This is the distobuccal and this is the distal, and ending in the distal surface of the buccal aspect. Also from the central pit, the lingual developmental groove runs in a lingual direction, passing between the 2 lingual cusps, the mesiolingual and the distal lingual, ending in a short distance at the lingual surface of the crown. So there are 4 developmental grooves: the central groove, which has zigzag shaped or form or irregular form, the mesobuccal, the distobuccal, and the lingual. So these figures provide a review for the anatomical landmarks of the occlusal table. This is the central fossa with the central pit at its center. This is the mesial triangular fossa and the less distinct distal triangular fossa. This is the mesial pit, and this is the distal pit. And each cusp has its own cusp ridge and triangular ridge, forming 2 transverse ridges on the occlusal surface of the mandibular first molar. The anatomic variation of the mandibular first molar: sometimes the mesial root may be bifurcated at the apical third. As you can see here, there is bifurcation of the mesial root apically. Sometimes there can be an extra cusp on the occlusal surface. As you can see in this photograph, there are 3 buccal cusps and 3 lingual cusps. So the tooth has an extra cusp on its occlusal surface.